My name is Dr. Jamie Caroon. I'm the medical director at the Center for Medical Cannabis Education in San Diego, California. In this video, we are going to be looking at a prospective observational study investigating the use of a CBD-rich hemp extract in a participant population with chronic pain taking opioids. This study is entitled Evaluation of the Effects of CBD Hemp Extract on Opioid Use and Quality of Life Indicators in Chronic Pain Patients. This study was published in October of 2019 in the journal Postgraduate Medicine. It is a single-arm cohort study conducted over 8 weeks involving adults with chronic pain who were on opioids. The intervention was a CBD-rich hemp extract that was delivered orally in soft gel capsules, and the participants selected their own dose by self-titrating. On average, they took around 30 milligrams of CBD per day. The primary outcome was changes in opioid use, and the secondary outcomes included 4 different validated instruments designed to collect patient-reported outcomes on pain, disability, pain severity and intensity, interference in pain in their daily lives, as well as sleep quality, which can often be interrupted by pain, and then the patient health questionnaire, which is a 4-item questionnaire that looks at quality of life. By way of background, it's probably not a surprise to anyone that chronic pain is a major cause of disability throughout the world. It is estimated that between 15 and 30% of the general adult population in the United States suffer from chronic pain, and that can contribute to $500 billion in annual costs just in the United States. Current treatments for chronic pain are not really adequate. The opioid crisis has emerged as a consequence of abuse of this class of medication, which certainly has a place in acute pain, but the value of opioids for chronic pain is really not substantiated by clinical trials. Also, there are a variety of different adverse events that can result from the use of chronic opioids, but also non-steroidal anti-inflammatory drugs like ibuprofen and acetaminophen. Consumers are demanding CBD for just about everything, and demand is growing, and it's very high, and it will probably continue to be high over time. Consumers are predominantly using CBD products to treat chronic pain conditions. And given the demand for these products and the widespread availability, we really need some clinical research to evaluate their safety and efficacy, because the products that are currently being used by people today don't have very much data to substantiate that safety and efficacy. In terms of the methods, this was a prospective single-arm cohort study that was conducted at one medical center. So it was a forward-looking study that had a single arm. This is not comparing the hemp-derived CBD group to a control or to a placebo group. This is comparing individuals at 4 weeks and 8 weeks back to baseline. So did their pain decrease? Did their sleep increase? Did their use of prescription opioids decrease over time? And there were 3 data collection points: baseline or week 0, week 4, and then finally week 8. Individuals were eligible for this study if they were between 30 and 65 years of age, if they had moderate to severe chronic pain for at least 3 years, if they had been on a stable opioid dose for at least 1 year, and if they were taking a morphine equivalent daily dose of at least 50. So for purposes of clinical research, the morphine equivalents are derived through a calculation so that we can compare an equivalent dose of morphine across a variety of different opioid medications. This is a study that I had published in 2018 in the journal Cannabis and Cannabinoid Research. It was a cross-sectional study of individuals who reported using CBD, almost 4,000 of them. And as you can see, the number one and the number two reason why these individuals reported using CBD was to treat chronic pain as well as arthritis and joint pain. There were 97 individuals that completed the study. 31 of them were male and 66 of them were female, so 2/3 female. They had a documented diagnosis of chronic pain and were on a stable opioid dose for at least 2 years. The mean age was 56 years. There were 131 participants recruited, 97 of whom completed the 8-week follow-up period. So the authors didn't state how many of those that were recruited were actually enrolled. So the attrition rate is calculated based on those recruited as opposed to those enrolled. Of the 97, 94 chose to use the CBD soft gels. It was not a requirement in the study. It was voluntary. So that is an attrition rate of around 26%, which is relatively high. And as far as dropouts are concerned, or adverse events, drowsiness was reported by 2 individuals and they stopped using the product. 1 participant reported a rapid heart rate, another reported nausea, and a third reported heartburn and dry mouth, but didn't discontinue using the product. And then finally, 1 participant reported that it increased her nighttime anxiety and disturbed her sleep. But no significant or serious adverse events were reported in this study. As far as the data analyses were concerned, the validated instruments were checked for reliability using a Cronbach's alpha. The means of normally distributed variables were compared using an ANOVA to compare the 3 different time points, 0 weeks, 4 weeks, and 8 weeks. The author stated the 3 levels of CBD-rich extract, but I think they meant the 3 time points. And then finally, statistical significance was determined using an alpha level of 0.05. The study drug was provided by a company called Ananda Professional. They're based in Kentucky. You can find out more about their products at anandaprofessional.com. A free 60-count bottle was provided to each participant by the company. As you can see in this table, the ingredients of each soft gel included roughly 15 or 16 milligrams of CBD and a half a milligram of THC, and then less than a milligram of a few other phytocannabinoids like CBDV, CBDA, and CBC. A botanical terpene blend comprised a very small amount of the overall product, around 1%. Terpenes and terpenoids are a class of molecules produced by a wide range of plants, including the cannabis plant, and they are known to have some of their own biological activity that is independent of phytocannabinoids, and they may synergize the effects of phytocannabinoids. The participants self-titrated their dose of CBD. So of the 97 participants who completed the study, 94 used the CBD soft gels, and 91 of them used 2 soft gels daily. So that's around 30 milligrams or 31, 32 milligrams of CBD per day, and also 1 milligram of THC. And one of the interesting things about this study and many studies that use formulas or botanical medicines is that there's a tendency to establish a cause and effect relationship between one ingredient in the formula and the various outcomes, even though there's a variety of different ingredients in this formula. So can we really say that the effects that were observed were due to CBD when there's also a variety of other compounds? There were 2 sets of outcomes, primary outcomes and secondary outcomes. The primary outcome was a reduction in opioid use, as measured by morphine milliequivalents, as I mentioned before. The outcomes were assessed at each of the 3 time points via phone calls or in-person interviews, or paper-based questionnaires and scales that were provided to the research participant. The 4 validated instruments that are used in the secondary outcomes all relate to pain-related quality of life. So the Pain Disability Index, the Patient Health Questionnaire, the Pittsburgh Sleep Quality Index, and the pain intensity and interference scale. So these 4 instruments are designed to allow research participants to report their level of pain, intensity, disability, the degree to which their pain is interfering with their daily lives, their sleep and the degree to which pain is contributing to sleep problems, and then overall quality of life. The PHQ-4 is a very short quality of life questionnaire. With regard to the primary outcome, the authors state that 53% of the participants that finished the study reduced or eliminated their opioids. That number obviously would be lower if the denominator in that calculation were all of the participants who were enrolled. But as we know, 26% of them dropped out for various reasons. And so 53% of those that finished reported reducing or eliminating their opioids. The authors state that 6 participants were able to reduce or eliminate their anxiety medications, and 4 participants were able to reduce or eliminate their sleep medication. This is table 1 from the study. It has the 4 validated instruments in the very left-hand column. If you look at the right-hand column, you can see the p-value for changes in these instruments over time, and this is compared to baseline. As you can see, there was a statistically significant change in the Pittsburgh Sleep Quality Index, as well as the pain intensity and interference scale. Here we're looking at the pain-related validated instruments. On the left, we have the Pain Disability Index. On the right, we have the Pain Enjoyment and General Activity Scale. The Pain Disability Index has a maximum score of 70. And so at baseline here on the left in blue, we can say the average score was 38 on a scale of 70. So this is moderately severe pain. At 4 weeks, the pain decreased a little bit. And then at 8 weeks, it decreased down to 34.1 on average. And so this is a reduction of almost 4 points on a 70-point scale. Over here on the right, we can see at baseline the average score was 6.5. And then by week 8, the score reduced to 5.7. And this was a reduction in almost a point on a 10-point scale. And so this particular finding was statistically significant, meaning that it changed over time in a way that was presumably not due to random error. It was presumably due to the CBD product they were using, but we can't be sure. Here are the other validated instruments. On the left, we have the PHQ-4, the Patient Health Questionnaire 4, and on the right, we have the Pittsburgh Sleep Quality Index. As you can see at baseline, the average score is 4.8, and it decreased to 4.5 over 8 weeks. That's a very small reduction of 0.3 points, and this scale is a 12-point scale, so it's a reduction of 0.3 out of 12. On the right, with regard to sleep, we can see at baseline the average score on the Pittsburgh Sleep Quality Index was 12.1, and it decreased to 10.3 at week 8. And this is a 20-point scale, so it's a reduction of almost 2 points on a 20-point scale. And neither one of these findings was statistically significant. With regard to the discussion, the authors state that the results of this study suggest that using CBD-rich hemp extract oil may help reduce opioid use and improve quality of life, specifically in regards to pain and sleep among chronic pain patients. In the discussion, they also go on to talk about preclinical and some clinical research that shows highly purified or isolated CBD to be helpful in individuals who are on opioids trying to reduce their dose or discontinue it. This study had a number of limitations. It lacked a randomized placebo-controlled design. So ideally, we would be comparing the 2 different arms, or maybe more than 2 arms. The group that received the CBD versus group that received some sort of control, maybe a placebo. And then we'd be able to see that one group fared better than another across these different outcomes. And so since we don't have that, we only have changes over time. We don't know if the changes over time were necessarily due to the CBD product. We just know that the changes were or were not statistically significant. The attrition rate was roughly 26%. As I mentioned, that's relatively high. With regard to our conclusions or the conclusions of the author, should we be stating that CBD led to these effects, or should we be stating that CBD-rich hemp extracts or this particular extract led to these effects? As I mentioned earlier, it's difficult to ascribe a outcome or change to one molecule when it's a part of a broader formula, even if it is the molecule that is in the highest concentration. It's also a little bit difficult to know what to think of the fact that each one of these participants determined their own dose. And so we don't really have very good information to determining whether one dose was maybe more effective than another. We just know that on average, they were taking around 31 or 32 milligrams of CBD per day. And then interestingly, if they were taking that much CBD per day, they're also taking 1 milligram of THC per day. And 1 milligram of THC is enough for some people to feel a change in their mental status or their perception. And I'm not going to go as far as to say that individuals would be impaired or intoxicated at 1 milligram of THC, but it's enough for some people to feel something. And it may be enough to contribute to a biological effect that may not be perceptible by the human mind, but may be noticeable or measurable in the body. Obviously, fentanyl patches cannot be titrated. The paper did not say how many of the participants were on fentanyl patches. And then, of course, we have to look at the funding. Ananda Professional funded this study, and there's nothing wrong with that, but we have to be skeptical when the funding entity is also the entity that has an investment in the outcome of the study. The authors state that the funders had no role in the design, the collection, and the analysis, or the preparation, although Alex Capano, who is the lead author, is employed by a company that owns Ananda Professional. So I'm not sure why that's not a conflict of interest, but the authors state that no potential conflicts of interest. As far as conclusions are concerned, the CBD-rich hemp extract may be helpful in reducing pain and improving quality of life in individuals with chronic pain taking opioids. Over half of the participants who added the CBD-rich hemp extract either reduced or eliminated their opioids over the course of 8 weeks. The CBD-rich extract at the doses used in the study appear to be safe and mostly tolerable. We need randomized controlled trials to corroborate these findings and to help us determine the appropriate dose. Thank you for your time and your attention. If you have any questions or any feedback, please email me at jamie@karoon.com. Thank you. Also, please return to Dr. Journal Club for more studies like this.